Hello there. My name is Jose Vasquez. I'm going to be performing an assessment on you, but however, before we begin, I'd like you to tell me your name.
Jack Frost.
So we'll go by Mr. Jack Frost. Okay, and the purpose of this assessment is we're going to be testing your physical strength and range of motion. We'll be grading it, and at the end of this assessment, we'll have a totality of scores that will give us certain measurements. So can you tell me what today's date is?
January 31st to 2020.
Okay, and can you tell me where you're at?
I'm in my apartment in Las Colinas.
Okay, so what we're going to do next is we're going to go ahead and we're going to go over the hearing aspect of this portion. What I'm going to be doing is I'm going to have to whisper in your ear, and I'll be whispering a series of words, and then I'll ask you to repeat what I said.
Red brick.
Okay, so you did say red brick, and I did say red brick. And then we'll go ahead and do on this side of the ear.
Train track.
Okay, so you did say train track. So we did perform the whispers for your hearing on each side of the ear. You check off on those. Now we're going to go ahead and cover your breathing. How is your breathing normally? Any issues with that?
No, I never had issues with it.
Okay, so what I'm going to ask you to do is cover one side of your nostril, and you're going to breathe out, and then you'll breathe in. Okay, any issues there?
No.
And then you're going to do the opposite side now. Breathing in, and then breathing out. Okay. Have you ever had history of breathing issues?
No.
Do you use oxygen ever?
No.
Okay. Now what I'm going to do next is we're going to be testing your lymph nodes. I'm just going to do a little bit of what we call palpation. That's actually just touching of the skin just to feel. So we're going to do your post-auricular, and I'll just be testing around here. And then we're going to do the submandibular. And then we're going to be doing the clavicular area. All right. Now next I'm going to have you do a gaze assessment. That is where we test the eyes. Now I have here a blue pen, and what the focus is you want to follow this pen without using your head. So I'm going to have you stare straight first, and just with your eyes try to follow the pen. That's 1, 2, 3, 4, 5, 6, and we'll just go up, back to the center. All right. So it looks like nothing going on there. Everything was working good. Next, I'm going to go ahead and take a listen to your heart. We like to listen to the heart and see how it's pumping, if there's any abnormal sounds. So I'll go ahead and listen a little bit over 3 seconds. All right, I do hear your regular heart sounds, and they don't have any negative issues from what I can hear. Now we're going to go ahead and listening to your lung regions. I'll be listening to 6 areas up front and then 6 areas in the back. We'll have you deep breathe in and out. Okay, now slightly lean forward. We'll be listening to the same regions in the back. All right. Your lungs sound clear, sound perfect. One of the last things we'll be doing today is we're going to be doing the testing of your muscle strength. First one we will be focusing on is the head strength and the neck, of the muscles in the neck. So I'm going to just place my hand here. I'm going to have you push forward with your head. Okay, relax. Then I'm going to have you push back. Good. Then I'm going to have you push to this side. Good, resistance. And then this side. Good. Now I'm going to put my arms on your shoulders. I'll be putting pressure down. I just want to see if you have any strength to push up against them. You sure do. Now we do the hands. What you're going to do is you're going to spread your arms out. And you can kind of bring them a little bit just together like that. Now we're going to have you go, try to push up. Good. And then down. Okay. Now we're going to push inwards. Good. And then we're going to go outwards. All right. Next we'll be moving down to your knees. And I'm going to have you go ahead and try to push upwards. And try to do it both at the same time.
The chair.
The chair, yes. Just a little bit of the chair moving, but you do seem to have both control of those with some good strength. Now, when we do the knees, the next things we focus on are just range of motion of the ankle and the foot, okay? So we'll just bring your foot out a little bit, and I'm going to have you flex upwards, okay? And then flex downwards. Good. Next foot. Good. Downwards. Okay, now just like we did with the arms, I'm going to have you go outwards. Good. Inwards. Good. And then I'm going to lift your legs a little bit and have you pull backwards. Good. All right. So overall, it looks like you're alert and oriented completely with it, Mr. Jack Frost. You have clear lungs. Your heart sounds within normal. You have great strength. Breathing's good. The only thing you use is just corrective lenses for your eyes. And that's it. So that was the first physical portion of this. Next, we'll move on to the Tinetti assessment, and I'll discuss that as we begin. Okay, Mr. Jack Frost, so we're going to go ahead and begin with the second portion of this assessment. The second portion of this assessment is called the Tinetti assessment. It has two portions to it. The first one discovers how well your balance is, and then the second portion will discover how well your gait is. This helps define if we have any safety issues with you as far as early identifiers that would cause you to fall. So we'll go ahead and begin there. So you are sitting on a firm, flat chair. You feel steady so far? Mm-hmm. So we'll go ahead and we're going to have you arise. You'll stand up. We're going to go 5 seconds. Okay, now I'm going to have you stand with your foot 4 inches apart or so. Make sure you have a good foundation. So far looking good and steady. Now I'm going to do some nudges at you. It'll be 3 nudges just to see. Testing your balance. So there's 1, 2, 3. Good. That third one moved you back a little bit, but you recovered greatly. Your steadiness is really great. Now I'm going to have you close your eyes, and we'll go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. If you can open your eyes, I'm going to have you turn around 1 circle back to where you're facing the front. All right. You feeling any dizziness? Okay, we'll go ahead and have you sit down. Okay, Mr. Jack Frost, so we've gone ahead and we've reached the final part of this assessment. This last part of the assessment is going to go ahead and cover your gait, which means your stride and your walk. So what I'm going to have you do is you'll walk down a few steps at your usual pace. Once you hit that table, you'll be turning around, coming back at a little bit more of a rapid pace. You can go ahead and start now. You can take a seat. Now this completes the assessment. Now when we talk about this assessment, we say it is an early identifier for our patients who may be a fall risk. So far it looks like you have great steadiness, great gait, no limping or any movements. We will go ahead and score that and see where we land at. Now as far as your home, we'd like to discuss any factors that could cause tripping and falling. Now, do you have throw rugs on your floor? Rugs lying around on the floor?
We have a rug.
You have rugs, are those taped down?
Yes.
Okay. So we just want to promote that, be very safe while you're walking around rugs. Some of those are easily to slip or the foot can get caught to it. We did do a little bit of an inspection earlier around the house, and I did see that you do have safety bars and safety handles for the shower. Make sure you don't have any slips. So we always encourage that. Now, do you have any pets as well?
No.
Okay. So hopefully no issues with animals coming around your feet and causing you to trip. Do you have grandchildren?
Yes.
Okay. How often do they come?
Like once a week.
About once a week? Okay, well just another thing is we have the grandchildren over. Just make sure you look for any loose small items that can cause you to slip. Make sure those are out of the way. And do you have any medications that you take at home?
Yes.
Okay. One other thing we like to promote is safety for those children. Just make sure that you have those medications at a high place, locked away with childproof, just for safety reasons. So, Mr. Jack Frost, I just want to thank you today for your time and for the opportunity to do this assessment on you.
Thank you.
Thank you.